Matthews. I'm a trauma surgeon by trade, and actually I was a chemistry major in college, and had I not gone to medical school, I would have become a chemist. So I view the body as a big chemical factory. Everything in your body is a chemical reaction. So I'm going to talk to you today about daily high-dose vitamin D supplementation to reduce the incidence of myocardial infarction in SICU patients. So I'm a surgeon by trade. Vitamin D is really a hormone. It's not a vitamin. It basically controls 3,000 out of 30,000 genes in the human body. It controls your inflammatory response and your immune response system. So imagine if you could learn to modulate, or you understand that and you can learn to control that. Imagine multiple different things that you can do with vitamin D. So basically I've spoken at the FDA, educating them on vitamin D 3 times. Vitamin D is taken off in the sports world. So we found out that you supplement athletes with vitamin D, you can decrease sports injuries, and they recover faster, and it's really taken off. Coaches have really got interested in this. The military is interested in this because they have a high level of stress fractures, spend over $200 million a year on stress fractures on recruits. So I work at Grady Memorial Hospital in Atlanta, Georgia. It's a level 1 trauma center. We're one of the busiest trauma centers in the country. Our trauma volume is up 15 to 20% this year. We're projected to go over 4,200 trauma admissions this year. And so our hypothesis was, we know that 50% of heart attacks occur in people with normal cholesterol levels. So the hypothesis was, does inflammation play a part in heart attacks? So vitamin D is one of the most powerful anti-inflammatory agents on the planet. So our hypothesis was, could we reduce the incidence of myocardial infarctions in our ICU patient population by supplementing them with high-dose vitamin D? As I stated earlier, vitamin D modulation inflammatory response system. We notice that patients, when you supplement them with vitamin D, the CD4 count goes up and C-reactive protein level goes down. So vitamin D deficiency is very common worldwide. Over 1 billion people in the world are vitamin D deficient. It's becoming because of our lifestyles. Now we live indoors, we're in a technology society. Only 10% of vitamin D comes from your diet, 90% comes from the sun striking your skin. So your steak and eggs are vitamin D deficient. So you only get 10% from that. So now we know that you have vitamin D receptors on every cell and tissue in the human body. As I stated earlier, it controls 10% of the human genome. There are 30,000 genes in the human body. Vitamin D controls 3,000 of those human genes. And so the most important thing is it plays a role in your inflammatory and immune modulation system. It actually increases your CD4 count, and actually stimulates macrophages to increase antimicrobial proteins. We know now that vitamin D deficiency is associated with over 100 different chronic diseases in the human body. So predisposing factors for myocardial infarctions, I didn't list all of them, just some of the big ones, or hyperlipidemia, hypertension, and tobacco. And you guys are well familiar with that, know more about that than I do. So what we know is that 80% of hospitalized patients are vitamin D deficient. We know that 80% of nursing home patients are vitamin D deficient. And in the wintertime, your vitamin D level drops 20 to 30% because the angle in the northern hemisphere is at a 45-degree angle. You need the sun at a 90-degree angle in order to make vitamin D. So if you're in the southern hemisphere now, you can make vitamin D. So that's why you get colds and flus in the wintertime. So the good thing about vitamin D is safe, it's cheap, and is effective. So why are we so vitamin D deficient worldwide now? Because in the African-American population, they have more melanin in their skin, so they need to stay in the sun 3 to 10 times longer than the Caucasians or olive-skinned people need to stay in the sun 3 to 10 times longer also. So obesity, vitamin D is stored in your fat cells, is not released into the blood system. There are certain medications that affect your vitamin D levels. A lot of our trauma patients have had transplants. They're on seizure medications, they're on steroids, they're on HIV medications. So all these would decrease your vitamin D levels. Vegetarians are vitamin D deficient. Anybody with inflammatory bowel disease live above the 32nd latitude, which is a line drawn from Atlanta to Scottsdale, Arizona. You can't make any vitamin D in the wintertime. So from October through February, March, you can't make any vitamin D in most of the United States right now. Indoor athletes, basketball players, football players, gymnasts don't make any because they're indoors. Sunscreen blocks 98% of vitamin D production. And as I said earlier, we're just like plants. You need the sun at a 90-degree angle to make vitamin D. Plants don't grow crops in the wintertime. We don't produce vitamin D in the wintertime. Dietary, 70% of Americans are lactose intolerant, and vitamin D is basically placed in milk. Indoor living, we basically live in an indoor society. Umbrellas, and in the Arab population, the burqas, those patients are severely vitamin D deficient. I've gone to Dubai 3 times. 96% of the women in Dubai of childbearing age are vitamin D deficient. And this is very important, something that's not really known. Acute illness or hospitalized patients, especially the trauma population, when they come in the hospital, within 24 hours, their vitamin D level drops 50% just due to the acute illness. So if you have a vitamin D level of 30, when you come in 24 hours later, your vitamin D level is 15. So basically that line should be drawn from almost Atlanta, Georgia, all the way down to Phoenix. So in that, anything above that line in the wintertime, you really can't make vitamin D. So this is our first vitamin D paper. Basically, we challenged the government's level of 30 as being the normal vitamin D level. The government says 30 nanograms per milliliter is normal vitamin D level. So we just looked at the numbers and let the numbers tell us what it was. This first inflection point is 13 nanograms per milliliter. When we got to this point, patients started down in our unit left and right from all causes. So in Annuals of Medicine in the End Things paper, they stated that vitamin D levels less than 18 increase your risk of death by 30% from all causes. So vitamin D levels less than 18, your patient has an increased risk of death. And so we found that our patient got in the 13 to 18 level to start dying from all causes. The second inflection point is 26 nanograms per milliliter. And once we got above 26, since we started doing vitamin D research back in 2008, we have not had a single person in our ICU with a level above 26 to die. The third inflection point you see is 40 nanograms per milliliter. That's where you get maximum bone density. That's important for ladies with osteoporosis. So you don't get maximum bone density till you get 40. And your PTH doesn't nadir till you get 40. You don't get maximum muscle contraction till you get 40 either. So that's important for athletes. So basically then once another inflection point up there should be 50. Once you get 50, you get maximum stimulation of your immune and maximum inhibition of your inflammatory response system. So basically, vitamin D is basically just like dopamine. At different concentrations, it does different things. Dopamine, you all been cardiologists know that there's dopaminergic receptors at a certain concentration, then it stimulates the beta receptors at a certain concentration, and a certain concentration stimulates the alpha receptors. So think of vitamin D like that. At certain concentrations, it stimulates various different tissues. So basically what we did was we looked at vitamin D levels in our ICU. Patients that had the lowest vitamin D levels were African American females, about 9.58 in sunny Atlanta. They also had the highest mortality rate. So lower your vitamin D level, highest mortality rate. They also had the second highest SICU cost, as you see here. So vitamin D deficiency associated with high mortality rate and high cost. Military is basically looking at vitamin D to enhance physical and cognitive performance in soldiers. So I work with athletes, and these guys set quite a few records when I started working with them. They had decreased injuries, they had phenomenal records. And that year we put 25 guys out of one class in the college with D1 scholarships, and that's unheard of. Usually if you get 5 or 10 guys in college, that's considered a big class. So since I've been working with high school athletes, we've put over 75 kids in college with scholarships over the past 4 years, 30 baseball players, 5 track athletes. So these are just some of the various different things you do with vitamin D. So what we did was we did a prospective study. We looked at 565 patients between 2009 and 2012. Group 1 gave them vitamin D 50,000 weekly. Group 2, vitamin D 50,000 IUs daily. The problem is that most people are worried about vitamin D toxicity. I've seen 0 vitamin D toxicities in all the time I've been working with vitamin D at our hospital, but 98% of our patients are vitamin D deficient. Remember that vitamin D deficiency, a level less than 18, increase your risk of death by 30%. So we're IRB approved. So the results we got, when we looked at the myocardial group, Group 1, we had 282 patients, Group 2, 283, and you see the age is about the same. There's no difference in their albumin levels, CD4 levels, there's no statistical difference. We looked at calciums and we looked at a few more variables. There was no differences in them. The male population was about 70%, female population about a third, African Americans 2/3, Caucasians 1/3. There was no difference in pneumonia rate. And then we looked at the MI rate. Group 1, they got vitamin D 50,000 weekly, we had 22 heart attacks. Group 2, where they got 50,000 daily, we had only 11 heart attacks. So that was cut in half. There was no difference in the age between the two groups, no difference in albumin, or no difference in CD4 count, calcium, or any other variables. And we looked at the groups, 1 and group 2. Group 1, they got 50,000 weekly, and this group got 50,000 daily. There was no difference in the age. However, if you notice, hospital length of stay decreased significantly in group 2, had a significant p-value. ICU length of stay decreased significantly, had a significant p-value there also. And the big thing is ICU costs. Went from $138,000 down to $31,000 with a significant p-value. Actually, the last couple of years, we've gotten back money from Grady, our hospital, because we've cut our hospital costs. Grady, several years ago, was losing $50 million a year. Now we have a $50 million surplus, so they're actually giving money back for cutting hospital costs and improving patient care. And remember on my graph I showed you, once you get down to a vitamin D level around 12, 13, and we start seeing a lot of more deaths. So group 1, they got 50,000 weekly, had a mean vitamin D level about 12, so they had more heart attacks. Group 2 is a little higher. Albumin, there's no difference, and CD4 count, there's no difference also. So we looked at group 1 and group 2. Like I said, group 1 got 50,000 weekly, group 2 got 50,000 daily, had 22 heart attacks in here, 7.8 p-value, 0.047, 3.9% incidence of myocardial, so we cut our myocardial infarctions down significantly. Last year in 2014, we had our first patient had the first heart attack from January through the end of the year. First heart attack we had was in September of 2014, and so we didn't have a single patient that had a heart attack between January and early September. You notice there's no difference in the ventilated patients. ICU length of stay decreased from 11.7 days down to 7.8. Hospital length of stay went down. ICU bed at Grady costs $4,000 a day. Floor bed costs about $1,200 a day. That's not counting the ventilator. Ventilator is about $1,500 a day, and dialysis is about $1,250 a day. So some patients can cost over $10,000. So if you can cut just 1 or 2 days in ICU costs, you can actually save a lot of money. As you see, our ICU cost went down also. And mortality rate, there was a trend toward lower mortality rate. However, since this data has come out, our mortality rate is down significantly since we've gotten even more aggressive with vitamin D supplementation. This graph here I wanted to tell you, okay, so in group 1 we had 13 deaths, group 2 we had 6 deaths. This is deceiving because most of these were withdrawal of care. We have some patients, so we do honor patients' wishes. Some of them, I do not want to be on a ventilator, I do not want long-term care, so we honor patients' wishes. So those are most of our mortalities in our ICU or withdrawal care. We very seldom have any mortalities at all now. So conclusion, high-dose vitamin D does reduce MIs, ICU costs, and hospital length of stay. Vitamin D is a powerful and inflammatory agent. Remember, Dr. Willoughby, you were talking about how could you reduce inflammation. There's your answer there. Actually, you can actually see most of the patients, I have not done an official formal study, but we do look at C-reactive proteins. Patients that have MIs, their C-reactive protein levels are high, 17 and 18. And once we start supplementing them with vitamin D, that level goes down. And you see the CD4 count go up. And so it's a powerful anti-inflammatory. Also, another thing that vitamin D does, it increases heat shock protein. You might want to remember that. What heat shock protein does is that every protein in your body has a function. And so when you go under stress, whether it's ischemia, hyperglycemia, hypoglycemia, hypothermia, once a protein loses its 3D shape, it loses its function. So you don't store protein. Every protein in your body has a function. So once you lose function, you lose that the cell loses its ability to react to do what it needs to do. So what heat shock protein does is envelop that protein and keeps it in its 3D shape so it can work. So when it's undergoing stress, that after the stress is removed, the cell can survive instead of dying. So these are some of the cases I want you to take a look at so you see what type of patients we're dealing with. We're not dealing with the everyday run-of-the-mill patients. This gentleman here fell 500 feet out the sky, parachute tangle, former parachute trooper hit the ground, went into cardiac arrest. Happened there was a paramedic right there on the scene, so he came in the emergency room in full cardiac arrest. He had over 18 life-threatening injuries with a traumatic brain injury. We calculated his mortality rate to be over 300%. This gentleman made a full recovery. Invest him today. He's actually married. His wife is from England. She wrote me a nice letter, sent me a picture, stating that she didn't know her husband when he had his accident, but she was glad we saved him because she thought she would never get married. And she said, I totally encouraged him to help his traumatic brain injury to start playing video games. So he met her online on video. So she moved to the United States, and she's a U.S. citizen now. They live in Savannah, Georgia, I believe. Every year they send me a card to let me know how they're doing. This gentleman is a 57-year-old male. He had self-inflicted gunshot wounds ×2. Basically shot himself after a traffic stop in front of 2 policemen. Shot himself in the chest with 2 policemen standing in his car. Barely missed his heart by a few millimeters. He actually had a stroke as soon as he got in the hospital. He also had a myocardial infarction. Ejection fracture went down to 25%. Developed congestive heart failure. He started on high-dose vitamin D. He got ventilator-associated pneumonia. He was depressed, had a history of alcohol abuse. Brother had just died. He was divorced. So this picture is this gentleman after he got out of the hospital. Okay, let me show you. After he got out of the hospital, basically, most stroke patients, can't stand and close their eyes and do this or bend down and touch their toes without falling over. So this gentleman basically can walk at least a couple of miles, walk them down several flights of stairs. Ejection fracture now is up to 45%. Basically, we got psychiatrists to see him. The problem I'm having with the psychiatrists now is that most of my patients, when they see him, they're off the ventilator. They won't admit him, but most of them have tried to commit suicide. I said, well, this guy's well adjusted, so it actually helps in post-traumatic stress disorder also. So the next picture is kind of graphic. You walk in the emergency room. This lady here, a 100-foot tree fell and impaled her through a car. This is her abdomen. This is her head up here, feet down here. This is side view. She actually has the tree coming through her, went all the way through, got intestines, bowel, and everything else. She had about 15 surgeries, and she's doing well now. This gentleman was pronounced dead by 8 different doctors, pulled the sheets over him for about 10 minutes. So I went to my operating room and just transfused a unit of blood. Heart started beating. Basically had an anoxic brain injury. He basically severed every vessel in his neck, cut his carotids, cut his internal jugular, everything all the way down to the bone. Basically, he came in cardiac arrest, had lost his total blood volume and stuff, and so we treat all our patients with high-dose vitamin D. You see that wound healed well. People's Magazine was going to do an article on him. He got himself arrested. So basically, I called the judge, and I was trying to explain to the judge this man had been pronounced dead. So you can imagine how that conversation went with the judge. He said, he's alive. He doesn't look dead. I said, yeah, an anoxic brain injury. He said, he looked fine to me. So all our patients usually do well. They recover well. This gentleman here, this young lady here is a 17-year-old. She's only child. Had her by artificial insemination, had a diffuse axonal injury. Anybody know anything about diffuse axonal injuries know that these are pretty bad. So we use it in traumatic brain injuries. We've had significant recovery. And this is her now. She's a junior in college doing well, straight A student. And so we actually treat all our traumatic brain injury patients basically by like dyslexia, have them take 1 or 2 classes and they slowly get better. This gentleman here to show you, I'm just showing you some of the multiple different patients that we see and the type of thing we deal with. This gentleman, 31-year-old male, he was assaulted. You see he did a craniectomy on him, let his brain out. He had multiple brain lesions, contusions. He was HIV positive, had subdural, subarachnoid hemorrhage, hepatitis A, syphilis, shingles, alcohol abuse, had a CD4 count of 46. So would you expect this patient to survive? He had ARDS, ventilator-associated pneumonia, made a full recovery, walked out of the hospital, and is doing fine. This gentleman here basically made the news. A lot of our patients are in the news. He was shot 15 times by gang members at point-blank range. This gentleman here, he wanted to get out of the gang. And basically we had teams in operating on all 4 extremities plus his chest and abdominal cavity. He survived, made a full recovery, and was able to get his life back and get out of the gangs. This young lady here, you see, was stabbed in the head, broke the knife off in her head, and so she had a right hemiparesis, who was stabbed in the abdomen also. 2 teams operating on her. She had a liver laceration, made a full recovery, and a hematopoiesis resolved. This lady was shot in the head, shattered the right side of her head, and you see brain tissue mission. She made a full recovery. So a little bit about my bio. My dad was a Baptist minister, sang with the St. John Gospel Singers, B.B. King, who recently died. He was the lead singer. This B.B. King. B.B. King was on vitamin D before he died. My mom had Siamese twin sisters. They were the first pair to be separated in 1955. Both of them survived. As a resident, the governor of Mississippi was in a bad car accident, so I saved the governor. He's in a serious accident. I was in New York during 9/11. This is Dr. Cove. He invented the dialysis. This is his son. I trained under his son, who's a cardiothoracic surgeon in Ohio. This is Arthur Guyton. He was chairman of our physiology department, taught us 50% of physiology. So I learned a lot from Dr. Guyton. And this is Dr. Hardy, did the first heart transplant at the University of Mississippi. Taught me surgery. That's my cousin. He was a director of minority health. This is one of our former patients. I told you my patients are in the news in Atlanta. This gentleman here had over 46 serious injuries and a traumatic brain injury, and worked for a large international insurance company. Actually got a promotion after he had his accident. He's back riding his bike 15, 20 miles a day. So these are some of my references. And so basically what we found out is that high-dose vitamin D, Dr. Willoughby, if you start looking at your C-reactive proteins, other things like that, it works very well. So toxicities are very rare because what people don't consider when they're talking about vitamin D is that most of our patients, when they come in, they may weigh 120 pounds. Then after you've been shot and we give you 30 liters of fluid, you don't weigh 120 pounds. So you have a different volume of distribution. So basically, most of the research has been done on vitamin D. They're using too small a dosages because patients in the hospital have a different volume of distribution than a patient who's walking around on the streets. So a person on the streets, 5,000 a day might suffice. It won't do anything for a patient in ICU. Then you see all the different medications that affect vitamin D levels and obesity. And so the average vitamin D level in our ICU patients when they hit the door is 15. And this is in sunny Atlanta. So vitamin D, basically, like I said, it basically think of it like you would dopamine. At different concentrations, it affects different things. So if you just worry about rickets, you want to get the level above 30. If I'm worried about infection or immune response system, I need to get it above 50. So at different concentrations, it does different things. So thanks for having me. And are there any questions about vitamin D, high dose, and reduced incidence of myocardial infarction?
Okay. Yes, I have a question. Vitamin D and thyroid hormones both signal through the retinoid receptors. I was wondering, is there any possibility that the supplementation might be improving thyroid function?
Yeah, I think it does have some help with the thyroid too. Thyroid, you know, I hadn't done any research on that yet, but I'm sure it does. Basically, there are receptors on everything in the body for vitamin D, so I'm sure it does have some effect. But I have not done personally any research on that.
Sorry. Excellent, professor. I had a question that your set of patients is very different. It's very deficient.
Yes.
Have you tried as a control? Because there are views that vitamin D does nothing in patients with MI, and there are certain views. And have you tried to see whether those people who have normal vitamin D level?
Well, actually, the medicine department at the hospital now, they're starting checking vitamin D levels and supplementing their patients. So just the internal medicine, the patients on the floor. Then there are cardiologists all over the country has been checking vitamin D levels and noticed that their patient population has improved. So actually, this is the worst of the worst. So if it works in these patients, imagine what it'll do in somebody that's not bad off as these patients. So it works in all patients, because I've had cardiologists call me and they said they've started checking vitamin D levels on their patients. They've noticed that they were severely low. They've noticed decreased readmissions for hospitals. When they get the levels up, they've noticed decreased arrhythmias and just all type positive effects. And the patients feel better. They're walking further. So it basically works on anybody once you get the level up. But you get the level up to 30, it's not going to work. You get the level above 50, it'll work better. Because like I said, the government says 30 is normal. I actually have spoken at the FDA 3 times, and invited me back for the 4th time. So after the 2nd time, they were thinking about raising the vitamin D level up a little bit and stuff, but the government is very cautious, and so they take their time and just kind of see. But everybody at the FDA basically started getting their vitamin D levels checked, and they found out they were vitamin D deficient too, most of the people who work at the FDA and stuff. So it helps everybody, but you have to get it above a certain, remember, like I said, think of it like you would dopamine. If you're looking at just 30 does nothing but just keep you from having rickets. So you can't say, oh, I got the levels above 30 and then I noticed no effect. So if you want a cardiac effect, you got to get that level above 50 because you got to worry about the inflammation that Dr. Willoughby is worried about. So if you're just looking at 30, your study going to say this was negative, but if you get above 50, you see results.
Yeah, because many vitamin trials failed because they were also tried in humans who had very normal kind of vitamin levels. And this particular vitamin being a hormone,
Yeah, it's a hormone.
being a fat-soluble vitamin, kind of you become very skeptical whether it has, lots of side effects.
Okay, remember.
Even in very high doses.
No, remember that it's, remember what it does is like increase calcium absorption. So remember, everything in your body, you need insulin to take glucose into the cell. You need vasopressin to move water. You need aldosterone to move sodium and potassium. So you need vitamin D in order to move calcium. So basically, vitamin D is an indirect ionotrope because it helps you absorb calcium better. So actually, it helps the heart beat a little better. And it increases magnesium absorption also, which calms arrhythmias down. So if you don't have vitamin D, or your patient's severely vitamin D deficient, they can't get maximum absorption of albumin, of magnesium, nor calcium. So basically, that's a twofold problem. What calcium helps the heart contract, and magnesium decreases arrhythmias. And so it does work. Like I say, you have to get above a certain level. And so the problem with most studies is they're using 30. Like I call some of my colleagues at Mayo Clinic, I trained at Mayo Clinic, and they are doing vitamin D studies on cancer and vitamin D, and they were using 30. I called them up saying, your study's going to come up negative if you don't get that thing above 50. And so they basically changed the level to 50, and I got away from the 30 and stuff, because you can't stimulate the maximum immune response system. This is like saying you're going to use dopamine and give somebody a dopaminergic dose, but you want an alpha adrenergic effect. So it's not going to work if you give somebody 2 micrograms per kilogram of dopamine when you should be giving them 20. So different concentration, it does different things. So once you understand that fact, you'll be able to work with it better. And then if your patient's on steroids, the levels are going to be lower. Patients obese, the levels are going to be lower. African American, they're going to have lower levels, so you need to get them above first.
Okay, I have a comment.
Sure.
Yeah. If you use vitamin D3 for cancer patients, if you use 400, average about 400 to 800 international units, they are significantly inhibit cancer activity. But if you use 2,000 international unit or higher, cancer marker immediately increases, and cancer grows much quicker. And so in the case of the heart, it is a little bit, higher dose can be tolerated. But for the cancer patient, it's fatal.
That is not.
And also, I'm not talking from my head. I'm studying through the patient, and we are measuring cancer parameters, and they really increases, and so. But unfortunately, first report came from one of the professor from University of Toronto several years ago. He measured 25 OH-D3, and with that, he recommended you have to have when you have a low, you have to use 2,000 units up to 5,000 units. But we are finding out it's absolutely incorrect. It's anybody over 800, it will be toxic for most of the people.
I think we should continue. We want to stay on schedule now. We're already right.